Welcome to Introduction to Public Health. I'm Jeremy Whitaker. This is Chapter 1. Now, what you learn in this chapter and in this course will help be a basis for what you learn throughout the major. So, looking at a brief history of public health, that up until about 150 years ago, epidemics were just a part of life. Now, Edward Jenner is famous for creating the smallpox vaccine, the first widely used vaccine. And John Snow is kind of a public health hero you're going to hear about in a lot of your classes, who helped stop the spread of a cholera epidemic through London in the mid-1800s. Again, what's important about both of those is that they happened before people understood that bacteria cause disease. So they're operating in the dark, but still kind of figured out how these things work. In the United States, Lammel Sheddock was the first one to call for local and state health departments. The Constitution and Bill of Rights do not talk about health as a right. Now, other documents that come out later do, but this is, again, before they're written at a time when people didn't understand how diseases were caused. Now, public health had a fairly small role in the country up until about the 1950s, after World War II. And again, this is a time where you have more immunizations, you have more antibiotics, there's more science on the prevention of it. So, what is public health? Really, there's a lot of definitions in the book, but in short, it's a workforce of varied professionals all focused on preventing disease. Three core functions of assessment, policy development, and assurance. Think of it as figuring out what the problem is, coming up with a strategy and implementing it, and making sure it worked. And then the 10 essential services kind of wrap around those three things, as the figure in front of you shows. Then the logic model, which is also one of your assignments. Basically, we're going to use logic models again throughout your education here. Talk about capacity, what are your inputs, what do you need to bring together, skills, expertise, and items. Then you come again, have a process to implement something, and then you have outcomes. So again, there are 7 unique features of public health. I'll focus here just a bit on the political nature and the link with government, that some of the things in public health are controversial, or at least seem controversial at the time. So, for instance, when the smoke-free air law went into effect, a lot of people thought their rights were, to have bars, smoking in bars was being invaded upon for the greater public good. When the HPV vaccine came out, it was controversial because people thought teens would be more promiscuous if they knew they couldn't get HPV because they had a vaccine. So, something to think about. Now, looking at the greatest accomplishments in public health, the biggest one at the top, people live 25 years longer than they used to because of public health. 30 years longer than they did in 1900, but 25 of those years are attributable to public health. And that, secondly, of course, deaths from infectious disease are a lot less common. Now, you still will see in the book the leading causes of death that pneumonia and influenza are still on there. But generally speaking, they affect people over the age of 80. And unfortunately, people have to die from something. And so sometimes it ends up being an infectious disease, but generally not, as you can see from the chart. And then the 10 greatest accomplishments, again, in that first century of public health on there. Some of these things seem very commonplace now. Tobacco wasn't identified as a health hazard until the 1950s. Motor vehicles, you didn't have to wear a seatbelt until the 1980s. So the things that maybe you grew up with weren't always in place, but because of public health, they are now. Now, looking at the homework, there are quizzes over chapters 1 and 2. I encourage you to do them immediately after you're done with the reading, instead of putting them off till the end. There's a journal article where you're going to do some research on your state and local health department and just write a little about that. And then 2 assignments, one over each chapter. Chapter 1, you're going to build a logic model. It's not going to be about public health. It's going to be about anything you want. And then chapter 2, you're going to look at the Healthy People 2020 document and pick out some of your things that you're interested in. And there's more about that coming forward. Thank you for watching and have a great day.